Checking care plan. I'm gathering my supplies. Knock, knock, knock. Good morning, Miss Smith. Is it okay to come in? Alrighty, so I'm going to provide privacy for the patient. My name is Kierra. I'm going to be your student nurse today. May I get your name and date of birth while just looking at your armband? All right, everything matches up. Do you have any allergies that I should be aware of? All right, patient stated that they didn't have any allergies. And are you experiencing any pain on a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain you ever felt? All right, patient states they are not in any pain. Okay, Mr. Smith, so today I'm going to be doing the head to toe assessment where I examine you all the way from your head to your toes. Is that okay with you? Alrighty, so I'm now going to start. I'm going to start by doing hand hygiene, putting on my gloves, making sure that the bed is locked and in the lowest position. But for this skill, I will be adjusting the head of the bed and the bed to my appropriate working height. All right, and I'm going to get started. So first thing I'm going to do, I'm just going to pull the covers down just a little bit. And the first thing I'm going to do is assess my patient's vital signs. So I will do the blood pressure first by using the two-step method. The blood pressure was within normal ranges, which is 120/80. I will also do the heart rate, which is 60 to 100 beats per minute. I will also assess the patient's oxygen saturation, which is 95 to 100 beats per minute. And I would do their respirations, which is 12 to 20 breaths per minute. Everything was in normal limits. So next I'm just going to ask you a couple questions. So do you know who the president is? Okay, do you know what year it is? Do you know what season it is? Okay, so my patient was able to verbalize that they could answer all the questions that I asked. So my patient is awake and alert and oriented to person, place, time, and situation. So everything's good there. And also while my patient was talking, I went ahead and assessed their speech. Their speech is clear. They don't have any drooping at the mouth. Everything seems to be symmetrical. And while I'm here, I'm also going to assess my patient's skin color. It is appropriate for the ethnicity. They are dressed and well groomed for the weather. My patient looks good. So the next thing I'm going to do, I'm going to inspect the scalp. So just going to look for any bruising, lesions, alopecia, and I'm going to lightly palpate the scalp to feel around it, to see if I feel any lumps, and look for alopecia. All right, everything is good there. And while I'm here, I'm going to go ahead and assess one of the bony prominences, which is behind the head, and then the scapula, which are behind the shoulders. All right, so next thing I'm going to do, I'm going to assess my patient's ears. So I'm going to go ahead, use my pen light, and I'm going to look inside of my patient's ears to see if they have any drainage. If they did, I will coach it. And I'm also going to look behind my patient's ears to see if they have any redness or deviations or any assistive devices. Then I will come around to the other side, do the same thing. So I will look in my patient's other ear and I will assess for any drainage. If there were any drainage, I will go ahead and coach it. I'm also going to look behind my patient's ears for any redness or skin breakdown and any other assistive devices, and they don't have it. Next thing that I would do, I am going to perform the whisper test. So what I want you to do, Mr. Smith, I'm going to whisper 3 words to you in each of your ears, and I'm going to cover one ear, and I just want you to repeat back what I said, okay? All right, let's go. 3. All right, patient was able to verbalize what I said. Come to the other ear. 3. All right, so my patient does not have any hearing impairments or any hearing deficits. All right, next I'm going to do, I'm going to come over to the eyes and I'm going to assess the perla. So I will cut the lights off for this. All right, so what I'm going to do, I'm going to check to make sure that my patient's eyes are constricted. So first thing I'm going to do, I'm going to flash my pen light. The conjunctiva is pink and the sclera is white. Now I'm going to assess the perla. So what I'm going to do now, I'm going to go ahead, look in my patient's eyes, make sure that it constricts, take the pen light away, come back to this eye and looking at the other eye to make sure that it constricts as well. Then I will go to the other eye and do the same thing. All right, so this one constricts, take it away, looking at the other eye constricts as well. Now we'll cut the light back on. Alrighty, so next thing I'm going to do, I'm going to assess the cardinal field of gaze. So what I'm going to do, I want you to follow the light with my pen, okay? And I'm going to place it right here, and next I'm going to assess. So don't move your head, okay? All right, so we're going to go to the middle, up, middle, over, middle, down, back in the middle, up, back in the middle, over, back in the middle, down. All right, so I just assessed the cardinal field of gaze. Now I'm going to do accommodation. So what I want you to do, I'm going to place my pen light right here. And when I'm doing this, I'm going to check to see that the pupils are constricting up close and that when I move it away, they are dilating. So what I want you to do, pick any spot on the wall, make it your favorite, okay? And I'm going to put the pen light right here. So I'm going to make sure that the pupils are constricting when I bring it closer. Then I'm going to take it away and making sure that they're dilated. So my patient's perla is equals our pupil, round, reactive to light, and accommodated. So everything is good there. All right, next what I'm going to do, let's see. I'm also going to check the nose to make sure that it's symmetrical. So what else I'm going to check for the nose is any obstructions or deviations. So I'm going to look inside my patient's nose, and I'm going to assess the nostrils to see if they can blow out of each nose. And while I'm here, I see that my patient does not have any assistive devices like oxygen to help them breathe. So they're good on that. Next I'm going to do, I'm going to come down to the mouth. So are you able to smile for me, Mr. Smith? So my patient smiled, they have all of their teeth, they don't have any dentures. So next I'm going to ask you to open your mouth and stick out your tongue. All right, so the mucous membranes are pink and moist. The tongue is pink, and the uvula is in midline. They don't have any odor. If they did have an odor, that would indicate halitosis or diabetes. Patient is good there. Next thing I would do, I would come down to the trachea area. So what I would have my patient do is look up at the ceiling, and I would assess to see if their trachea is in midline. So trachea is in midline. And while I'm here, I'm going to go ahead and assess the JVD, which is the jugular vein. So I'm going to instruct my patient to turn their head to the right and turn their head to the left. And what I'm looking for is to see if that jugular vein is sticking out, because if it is, that can indicate a sign of fluid volume overload. All right, so patient did that. Next thing I'm going to do, I'm going to come down here and I'm just going to look at my patient's arms to see if they have any IV lines. They don't have any IV lines. They don't have any lesions, bruises, or bumps. So I would do the same thing for the other. No IV lines, no lesions, wounds, nothing. Patient is good there. Next thing that I would do while I'm here, I will go ahead and assess skin turgor. If it were an elder patient, I would come up here and assess skin turgor, and then I will come down to the hand and I will assess skin turgor like this. And what I'm doing here is assessing for tentin, because tentin is a sign of dehydration. While I'm here, I'll go ahead and do the pulses, the radial pulses bilaterally on both sides. So they're 2+ bounding, which means normal. Then I will go ahead and do capillary refill. All right, so capillary refill returns back into normal, which is 3 seconds. And I will do it on the other hand too. And that one return back to normal within 3 seconds. The next thing that I would have my patient do is the pronator drip. So with the pronator drip, I would instruct them to lie in bed, and then I would have them hold their hands out like this and close their eyes. And what I'm checking for here is to see if they have any shifting, because if they have shifting while they're holding their hands out, that can indicate a sign as a neurological deficit. All right, so we're good on that. So next thing that I would do is I would do some range of motion, where I instruct the patient to raise their right arm, then they'll raise their left arm. So range of motion is good there. And next thing I'm going to do, I'm going to go ahead and assess my patient's lung sounds. All right, so put my stethoscope in. And I would assess the lung sounds with the diaphragm of the stethoscope. So I'll start right here, one in and out, over here, breathe in and out, down here, breathe in and out, down here, breathe in and out, down here, breathe in and out, and down here, breathe in and out. All right, so I don't hear any crackles or wheezing in the anterior part. So now I will cover the patient back up, and now I'm going to assess the posterior part of the lungs, and it has 8 spaces. All right. So breathe in, out 1, in and out 2, in and out 3, in and out 4, in and out 5, in and out 6, in and out 7, in and out 8. All right, so I also don't hear any crackles or wheezing on the posterior side. So next what I'm going to do, I'm going to go ahead and assess my patient's heart sounds. So I'm going to pull this down again. And with the heart sounds, we use both the diaphragm and the bell. So that's what I'll be doing here. All right. So we have aortic valve, pulmonic valve, Erb's point, tricuspid valve, and mitral valve. And when I get here, I'm going to assess the fifth intercostal space, which is also known as the apical pulse, for 1 full minute. The apical pulse is within normal limits, which is 60 to 100 beats per minute. All right, so next I'm going to cover my patient back up, and I can also pull the gown back down to look for chest expansion. Everything is good there. So then I will come over here and I would ask my patient to stroke their shoulders. So my patient was able to stroke their shoulders, okay? So next thing I'm going to do, I'm going to go ahead and assess the abdomen. So I'm going to pull down up, and I'm just going to ask the patient about their recent bowel movements, or when was the last time you had a bowel movement? Do you have any dietary restrictions? They said no. Okay, so what I'm going to do now, I'm going to auscultate using the diaphragm of the stethoscope, and I'm going to listen to the bowel sounds. So I'm going to start in the right lower quadrant, up to the right upper quadrant, up to the left upper quadrant, and down to the left lower quadrant. And next what I'm going to do, I'm going to palpate the abdomen going in the same order. And anytime you feel any pain or discomfort, please let me know, okay? So I'm going to start gently and lightly palpate the abdomen. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. All right. And then after that, I'm going to go down to the bladder to check for any distension. So before I do that, I will look to see if my patient has any ostomy bags or urinary catheters or any other things to help them promote stool or urine. Patient does not have any of those things. Then I will come down and I will ask, are you having trouble urinating? Are you taking any medications such as diuretics to help you promote peeing? Patient says no. So next what I would do is I would gently palpate the abdomen, the bladder, to see if it's distended. All right, bladder is not distended. Next what I'm going to do, I'm going to auscultate with the bell of the stethoscope to check for the abdominal aorta. And this will be for 1 full minute. I'm going to come right here. All right, so it is within normal limits, which is 60 to 100 beats per minute. So now I can cover my patient back up. And next thing I'm going to do, I'm going to go ahead and pull the covers down, exposing the legs and the feet. And what I'm going to do here, I'm going to check to see if my patient has any bruises or lesions on their upper thighs and lower legs. Patient does not have any of those. Then I will come down, I would assess for edema. So I would gently press down on both of my patient's legs to see if they have any edema. No edema is present, which includes non-pitting edema and pitting edema. Then I will come down here and I will assess my patient's capillary refills on both toes. All right, capillary refills return back into normal, which is 3 seconds. Then I will come over here and assess my patient's pedal pulses. They're 2+, which is normal. And then I will come over here and assess the femoral pulses. They are also 2+, which is normal. And then when I come down here, I will go ahead and assess the heels of the patient, which is one of the bony prominences. Alrighty. And then I will come up here and assess the elbows for the bony prominences. Okay. And then next, I'm going to cover the patient back up. And next, we're going to do gait. So With gait, Mr. Smith, I want you to walk from the bed to the door and then back to the bed. So what I would do here, I would lower the bed to the lowest position, making sure that the bed is locked for the patient's safety. I will raise the head of the bed all the way up until they feel comfortable, and then I will assist them out of the bed. But first, I will let them dangle for a minute just to get just to see if they're able to get up or if they're having any dizziness or things like that. Then they will walk from the bed to the wheelchair. And what I'm doing here, I'm assessing gait. My patient's gait is steady. They do not have any assistive devices such as walkers, canes to help them walk. So patient is back in bed. Next thing you know, I will put the covers back on the patient. All right. And then I would thank them for letting me do my head to toe assessment. So thank you so much, Mr. Smith, for letting me do my head to toe assessment. So next what I'm going to do, I'm going to ask my patient if they need anything. They don't need anything. So I'm going to make sure that the bed is locked and in the lowest position. I'm going to have my patient their call bell, and I'm going to take off my gloves, wash my hands, and I'm now done.